Have you ever had the experience of going to your primary care physician, getting some blood work done because you're not feeling well, and the blood tests come back, quote unquote, normal? And your practitioner says, it looks like everything is fine. You should be good. And you leave thinking, okay, well, now what? Because I still have the symptoms and now I don't know what to do next. So I've been in functional medicine for almost 20 years now, and I've dealt with this on my end. And I've also had many practice members who've had this experience. We had to come up with different ways of working with people to help identify why you're getting the symptoms that you're getting and what you can do about it. Watch this whole video because we're going to talk about what you can do for managing your own health. Well, let's talk a little bit about blood tests and what they're looking at. Because our body's highest priority is to keep our blood happy. For example, if your blood wants some calcium, your blood is transferring through the whole body. It's going through your brain where it's taking an inventory to say, what are the minerals and what are the nutrients needed? Do I need calcium? Do I need iron? Whatever that might be. And if it identifies that, for example, your blood needs calcium, then it will try to find the calcium somewhere in your body. So most likely, it'll take the calcium from your bones or your teeth and give it to the blood so that it can maintain the optimal levels in your blood. So when we do a blood test, if you imagine that this is like a spectrum of health, right? So if this is you in perfect health, this is you in not so perfect health. What a blood test is actually testing for is that last 10 to 15% on the health spectrum. If your test results come back, quote unquote, normal, the good thing about that is that you have enough reserves, or your body has been able to maintain the need of the blood by finding resources most likely within your body. But the challenge is that regardless of what your numbers come back like, whether they're in range or out of range, we still don't really know where your body is taking resources from in order to keep your blood happy, right? So for the calcium example, yes, most likely your body is taking the calcium from your bones or your teeth. But what if it needs magnesium, right? Magnesium can be in different parts of your body. But what if it needs protein? Protein is in different parts of your body. We don't then know what is causing those numbers to maybe go askew. Or if we're looking at your blood work from a functional medicine perspective, we're having a narrower range of what we're looking at, but we still don't know where your body's taking resources from. In emergency care or urgent care, blood tests are really, really helpful because it really tells us what's happening in that moment. Why is our body going towards crisis mode? And how can we support the body? But I'm in the world of healthcare, right? Navigating the day-to-day aspects of our life. And how do we optimize that so that we can keep our blood happy, but that we can also keep the other systems in our body happy as well? So that's where we enter in other tissues that we can test for. So for many years, I had people testing urine or stool or hair or saliva, a combination of things. And it was great because we were starting to see where the body was taking resources from. But what was challenging is that all of these tests, while they were super helpful and super valuable, they were still limited in what we were looking at. Sometimes people would have to take multiple kinds of tests. So maybe you've had the experience that you worked with a functional medicine practitioner and you've done the stool testing and the urine testing and the saliva testing. And that is all helpful information, but it can add up in terms of cost and effort. About 5 or 6 years ago, I was introduced to a company that does hair saliva testing and the combination of it. And so I had done HTMA testing using hair. I had done saliva testing for neurotransmitter function. So I was familiar with using different tissues. But what was really cool about this company is that I now have the ability to look at a much, much more comprehensive overview of what was going on in the body. So if you look at the picture on the side here, these are the things that are tested. We're looking at 58 different points in the body, which correlate to different organ and or acupuncture points. We're looking at how that impacts 14 systems of the body, about 350 different food, primarily some environmental sensitivities, which is different than food allergies. We'll talk about that in a different video. And then we are looking at how the body is absorbing nutrients, right? Because many times I get people who come in saying, I'm eating all the right things, I'm doing all the right things, and yet I still don't feel great. And so this helps us identify how your body is absorbing different nutrients, right? So it could be the vitamins, the minerals, the enzymes, the amino acids. all of that is what we can see. And then also, if your body is holding on to any kind of pathogen, pathogens can be a little scary for most of us to think about because we sometimes think of it as exposure if we were in a third world country, or maybe we ate something that didn't suit us. But the reality is that we're exposed to pathogens on a much more frequent basis than we might realize. And if you've ever had something like mono, for example, you might have gotten rid of the symptoms pretty quickly or maybe after a week or so. However, the virus can remain dormant in your body, right? And so it can get flared up by additional stress at some point down the road. And so that is true for all of these pathogens. They like to get deeply embedded in our bodies and then they'll get really comfortable and cozy. And it can be hard to detox them sometimes. But we're going to look and see if there are any pathogens that might be impacting your nutrient absorption, right? Because pathogens are kind of notorious for binding to the receptor site for actual nutrients. And so, again, we look at how the nutrients are getting absorbed, but it's possible that if there's a pathogen blocking the receptor site, that could be impacting your nutrient absorption as well. And then we'll also look at 30 different hormones in your body and identify the top 4 that are out of balance for you. So we've spent most of the analysis looking at what are the different triggers for your body that could be producing inflammation. But then at the very end, we look at what are the different types of supports that would actually start to aid your body specifically to move the needle the most so that we can start to get you back in balance. So now that we've talked about the hair saliva analysis, let's talk about how you do it. You can order a test kit from me and we will drop ship a test kit for you if you live anywhere in the United States. And once you receive the test kit, it's pretty simple. This doesn't hurt. Maybe you just have to cut a little bit of hair, but otherwise it doesn't hurt. This is a very, very simple process. So you would cut about a teaspoon worth of hair. So not a whole lot, maybe like this much hair. And it doesn't have to be from the root because we want to see what is impacting your day-to-day health. So if you typically get your hair colored or treated, that's okay. We don't need it to be from the root. We want to see what is impacting your body on a regular basis. And then you would collect that teaspoon and put it in a little baggie, which is going to be sent to you as part of the test kit. You could also collect some fingernail and or toenail, especially maybe if you don't have a whole lot of hair on your head, or maybe you just had a haircut and you are meaning to clip your nails anyway. You can include that as well. And that would all go in this little baggie here, about a teaspoon worth. And then you would swab the insides of your cheek for about 15 seconds on each side. So no spitting in tubes or no trying to collect your saliva in somewhat difficult ways sometimes. But you just have to swab the insides of your cheeks. I've done this for my own newborn when she was little. I've had practice members do it for their babies. And we just swab, stick it back in the tube. That's good to go. As part of the kit, there is also a link for an intake form that you'll fill out. And that's just to get a little bit of history. So that's on the intake form there. Plop everything into the bag. There's a prepaid shipping label. Get this off into USPS. And that's it. You're good to go. It takes about 2 weeks to receive the result. Once the lab has received your sample, then I would email you the result. We would go over the findings, and then we would go over next steps from there. If you have any questions, please feel free to reach out and we'd be happy to help.